welcome to today's episode. I am so glad you are here with me. If this is your first time here, my name is Chong, your fertility dietitian and founder of Pristine Fertility. Now, if you have been doing everything through eating better, tracking your cycle, taking all the supplements, I know sometimes it can feel like nothing is working, right? Or you might be someone who have been told to just take a prenatal supplement and hoping for the best, and you're absolutely not alone. And you are definitely not doing anything wrong, but the truth is, fertility is often very complex, and when it comes to nutrition, guessing isn't just enough. I know it can feel super frustrating, but it also means that if you're not taking on the right step, you can waste all this precious time, money, and most importantly, emotional energy. That's why in today's episode, I'm going to walk you through the 5 essential nutrition blood tests I recommend checking before even you take or changing your supplement. And these are the markers I commonly look at with my private clients so they can stop the guesswork and start to build a plan that's actually tailored to their body. And I want you to do the same as well. Let's get into it. Number 1, vitamin D. So let's start talking about vitamin D. Now, vitamin D is one of the most important but often overlooked nutrient when it comes to fertility. Now, you probably have heard about vitamin D is essential for bone health, but did you know that it also plays a very crucial role when it comes to supporting your fertility as well as pregnancy? So vitamin D helps with hormone balance, egg development, ovulation, and even how well your uterine lining can support implantation. Now, here is the thing, even if you lived in a sunny country, your level might be still low, especially if you are constantly staying indoors a lot, or you may wearing clothes that cover up your body, or use your sunscreen daily, right? Now, in one study, women with unexplained infertility had a vitamin D level that is really low. Now, unlike women who were fertile, what the researcher found that averagely they have a much higher level of vitamin D. In another large review, also looked at women specifically going through IVF and found that those with replete vitamin D level, at least about 75 and more per liter, had a better fertilization rates and higher chances of live birth. So while not every study shows a very clear link to pregnancy success, what we see is that this study tend to reflect on a lower vitamin D level might make it harder for your eggs to mature properly or even fertilize properly. So my tips for you today is don't just assume your levels are fine, making sure that you check with your doctors to test your vitamin D first. And if you are low, make sure again you discuss with your doctors or your fertility dietitian just about how much you need to supplement safely, as often your preconception or prenatal supplement may not always have the essential dose to correct vitamin D deficiency. Now, next up, ferritin, which also means it's a measurement to say how well is your storage in terms of your iron level. Now, iron is essential for ovulation, a quality as well as a healthy uterine lining. And yet, many women don't realize they are actually iron deficient until it's affecting their body. You might feel really fatigue, tiredness, your cycle might get impacted as well as implantation. Now, a study with nearly about 300 women with low iron found a raising ferritin level from 16 up until 80, right, led to literally doubling the rates of live birth success from 26% up until 51%. What the researcher also found that miscarriage rates also dropped from 28% to 13%. Now, that is huge if you're just looking at the number. And it shows that just by correcting a simple iron deficiency can significantly improve the outcome, right? Now, here's something that important that most people miss. Now, many prenatal vitamins only contain a very small amount of iron, so just enough to maintain the levels, but not enough to actually correct any iron deficiency issue. So once again, if your iron storage or your ferritin level is low, you may need to take double the dose or even more to bring it back to the correct level, ideally before you even fall pregnant. So this is where testing matters. So too little iron can affect egg quality, egg health, and implantation, but too much, of course, it can also lead to overloaded with iron that can lead to oxidative stress and can do more harm than good. That's why I always recommend for you to discuss with your doctors first, as well as working with a fertility dietitian like myself to help you to interpret your blood work and to build a plan that is safe as well as personalize it for your body. Now, moving on next, let's talk about folate. This is probably one of the most popular nutrient, most talked about nutrient in fertility care, and is for all the good reason. So folate is a B vitamin that plays such a major role when you're trying to get pregnant as well as during pregnancy. So folate helps to support DNA synthesis, which is crucial when your body trying to grow a new life. It also helps your eggs mature properly and to reduce the risk of neurotube defects, which happen very early in pregnancy, often before you even know you are pregnant. But here's what most people don't realize. Not all folate is created equal. And just taking a generic folic acid supplement doesn't always guarantee you are getting enough, especially when it comes to different type of folate supplement, the doses as well. And we want to make sure that your body actually are able to absorb it properly. Now, in one study of women going through IVF, those with higher folate levels in their blood were 62% more likely to have a live birth compared to those who have a lower levels. Now, even more interestingly, when I read this study, when both folate and vitamin B12 levels were in the healthy range, the chances of live birth of pregnancy almost doubled. Right. Now, let's talk about neurotube defects preventions as well. So we look at something what we call red blood cell folate. This is often measured and tested at a population level. So it's a much better indicators to look at folate store in your red blood cell. In fact, the World Health Organization actually recommends to check red blood cell folate levels, and it found that women who reach certain level of red blood cell folate level has a much better chance in terms of helping to reduce the risk of neurotube defects at the population level. However, the problem though, red blood cell folate is rarely tested at the individual level. It is much more commonly used in the population level data. So if your folate store are low, they don't usually bounce back overnight. And what we know so far is it can take weeks or even months to build up your level through food or through the folate supplement. And this is why you always hear about it's so important that to start to take a folate supplement, in particularly your folic acid supplement, ideally before you even try to conceive, at least a month before. Now, if you're unsure about whether your folate levels are or whether you are taking the right type of dose for your body, especially if you're curious whether you have the MTHFR gene variation, this is something we can absolutely assess together in the Express Supplement Review. Are you confused about your supplement routine? Not sure if you're taking the right one? You are not alone, and that is why I created this Express Supplement Review. So whether you are trying to conceive naturally or preparing for IVF, I will work with you to review your current supplement plans to ensure they are safe and effective for you. And I will also review any nutrient gaps in your blood tests and personalize a supplement plan tailored to your fertility goals. So you'll walk away with clear, customized supplement plans, so every capsule you take, it's working for your fertility. If you're interested to learn more, make sure you click the link in the description box now to find out more. Welcome back. Now let's talk about something that almost never gets mentioned in a standard fertility checkup, but absolutely, in my opinion, you should be get tested. It's called homocysteine level. So homocysteine is a natural sustain your body makes when it breaks down your protein. but it's supposed to be cleared out of your system by certain nutrients like folate, vitamin B12, or B6. But when those nutrients are low, homocysteine can start to build up in your blood, and that's when the problem can arise. So elevated homocysteine has been linked to increased inflammations and oxidative stress, poor egg and embryo quality, greater risk of miscarriages, as well as lower birth rate in future pregnancy. So let me break down a few more key studies here. So one study compared women with unexplained fertility to fertile women. The infertile group had significantly higher homocysteine levels, and on average, we're talking about the number here is anything over 13, right? Micromole per liter compared to just under 10 in fertile women. So what even more the story is, about 40% of infertile women had a very high level, literally above 15, and compared to only 17% of the fertile group. And another IVF study also looked at this homocysteine level, especially for women in their follicular fluid level. So the fluids surrounding the eggs, which supply the nutrient for the egg proper growth and development. So what the study found that the women with levels above 9.8 micromole per liter had fewer matured eggs, poorer quality of embryos, as well as lower fertilization rates, right? So meanwhile, those with lower level had more high quality embryos and better outcomes. So here's the thing, and another really fascinating recent study also shows that over 190,000 women in Europe, women with genetically higher homocysteine level, especially due to MTHFR gene variants, also experience slightly earlier reproductive age aging. That means earlier menopause, and their baby also had a low birth weight on average. So what are these study or numbers telling us here is, although we don't have a very clear or high quality of study, but definitely even, if you look at your folate or your B12 levels look normal on the paper, but if your homocysteine level are still high, that could still mean there might be something going on that silently affect or influencing your fertility, which is why I always include that homocysteine testing for all our program clients inside the Mastering a Health program. It gives us just a better picture rather than guessing to understand your methylation and detox pathway and how your body is handling all these single key fertility nutrients. And if your homocysteine level is higher, the solution might be that we need to adjust your supplement, either the type of folate you're taking, the dosage, to make sure that we are done it correctly with the right testing and guidance. All right, and finally, let's talk about zinc. So zinc is a little quiet little mineral that doesn't always get much attention, but it does also play a huge role in fertility for both women as well as for men. So zinc is essential once again for egg development and maturation, hormone productions, right? Like all the follicular stimulating hormone, your LH luteinizing hormones that regulate ovulation. It also helps to protecting the eggs and sperm from oxidative stress and supporting fertilizations and early embryo development. But here's the thing, many women can be low in zinc without even knowing it, especially if you're someone having indigestive issue like IBS, or maybe you're following a vegetarian or vegan diet, or you might be someone suffering from chronic stress or after a long-term use of medication like the pill. So what we typically assess is the serum zinc, which can be easily done in a blood test. While I want to mention that it is not the most sensitive or accurate test, but if zinc comes back abnormally low, there is a high chance that you might be zinc deficient, that we might need to look into whether you are getting it enough through diet. We might think about how we can supplement this further, right? On the flip side though, supplement thing with very high dose of zinc can also interfere with copper and iron balance. So this is something that is so important. The reason why I keep on stressing about you need a personalization plan to make sure that you're working with a fertility dietitian like myself to look at your test result, your overall nutrient status, as well as fertility goal. to make sure that we are really supplementing the right dose, in the right time frame. Most importantly is to doing it safely. All right, so let's recap the 5 must-have nutrition tests before you spend another dollar on your fertility supplement. Number 1, vitamin D. Number 2, ferritin. Number 3, folate. Number 4, homocysteine. And number 5 for zinc. So remember, your body is unique, so what works for someone else might not be what you need. So please stop guessing. With supplement can often waste not only the money but the time that is incredibly pressure, especially when you're trying to conceive. That's why testing matter, and I really want to help you to create a simple ways to help you to move forward. So you can book an express fertility supplement review if you're interested, where we're going to sit together to have a look at your blood test one-on-one and your current supplements routine together, and I will help you to draw your very personalized plan exactly of what you need and what to let go of. Or you might be just getting started and you want to learn more different way to optimize your fertility and egg health, so make sure you also visit the link in our description to grab your free fertility e-guide. Now, if this episode helps you, please like our video, subscribe to our channel, and don't forget to share it with someone else on the same fertility journey like you. And remember, you are not behind and your body not broken. And I really appreciate that you are listening to today's episode, and I'll see you again in the next episode. Bye for now.